Hi, my name's Rachel and I'm from Gemma, and today we've got Gemma Carlier with us. Gemma, do you want to introduce yourself, please?
Hi, I'm Gemma Carlier. I'm an occupational therapist and I've worked with children and young people, and I'm looking forward to having a chat.
Oh, thanks, Gemma. So what we want to find out a bit more today is about what occupational therapy can do to support children with additional needs. So could you tell us a bit more about what you might do as an occupational therapist to support children with additional needs?
Yes. It would depend a little bit on where the occupational therapist who is working with you is based in terms of their setting. So I have worked independently, offering support for children and their families. However, the remit of an occupational therapist would vary if I was based in the NHS, for example. So there would be different criteria for which we would accept and work with children, and different kind of professional and service boundaries in terms of referrals that we would accept. For myself, having worked with children and young people as an occupational therapist, we very much kind of focus on things like the person, the occupation. So what is it that they are struggling to do, or where are the challenges, and things like the environment. And as an occupational therapist, we very much recognise that for some people, environment, whether that's social or physical, can be the main and most significant barrier to them being able to progress. So I have worked in collaboration with families, with young people, with local authorities and schools. And that's been around perhaps assessing a child, so completing a very robust and complex and detailed assessment. As an occupational therapist, my primary kind of concern is whether or not a person can engage with the occupations that they want and need to engage with, and exploring what the barriers to that might be. So I might be exploring that in terms of kind of things like fine and gross motor skills. I might be looking at things like executive function. I might be looking at it in relation to sensory processing differences. I might be looking at it in terms of things like self-regulation and emotional regulation, and those types of things as well.
Yeah, thank you. And what kind of goals do you typically work on with children and young people with additional needs, and kind of how do you establish those goals?
So goal setting is a collaboration. So ideally, it would involve working with the young person, and quite often their family or the support network around them. Depending on the setting where I have been working with that young person, it might also involve working with, for example, teachers, or if it's an alternative education provision, for example, it might be working with a team in a different area or a different setting. So goals really ideally are collaborative. They must be meaningful for that young person in order for them to engage with it, and for it to be serving a purpose for them. And the goals could really vary and range quite significantly. So sometimes they might be something that's focused on education. So is there something around education that is difficult, creating a challenge for them to access? But also we work with all occupations. So we would work with things like education. We might look at things like play. We might look at things like self-care, and the things around that. And that might include things like kind of feeding, looking after your kind of personal care. So haircuts, toothbrushing, washing, wearing clothes, if tolerating clothing is difficult. And it might also be, did I mention sleep? I'm not sure, but around kind of sleep and sleep hygiene, or challenges with sleep, which so many of our kind of neurodivergent children and young people really have challenges with. So, yeah.
And Jam Up's kind of focused around everyday tasks or kind of life skills like getting dressed and cleaning teeth. So how, as an occupational therapist, might you support some of those life skills?
Again, it relies on a really kind of robust assessment of sort of individual needs. So we would complete our assessment and decide, what are the main components of that activity that are presenting a challenge. So I know that we've spoken before in some videos about the range of different factors that might influence whether, how a child is kind of managing with those tasks. So is it a motor difficulty? Is it something to do with posture and balance? Is it something to do with sensory processing that's making that really challenging for them? Is it anxiety and difficulties with sort of staying regulated because of expectations throughout the day? So it really relies on a kind of good assessment and sometimes a really good discussion with that young person and perhaps their parents and carers to establish really where the kind of main barriers are. And then we would think about the most appropriate strategies that might support them. And again, so that might be giving skills or teaching skills, but it might also be looking at, can we adapt this? So does it need adapting? Does something need to be different about the task? Does something need to be different about the environment that young person is having to kind of function in?
Thanks. And you mentioned sort of sensory processing. So what kind of strategies or tools might you use to support children or young people who might need extra help in that area?
It would depend again on what the task is and which sensory system is involved or presenting kind of the most challenges. But it could be all sorts of different things. So it could be around, if it's around the tactile system and being able to tolerate those personal care issues in the morning, because there are so many demands on the tactile system first thing in the morning, because we're having to maybe brush our hair and put on clothing that feels uncomfortable. We might be having to shower, which can be for a kind of overactive or a highly alert tactile system can be quite significant and stressful activity. So there's lots of expectations early in the morning. So we would think about, can we adapt those activities? So can we do things differently? Maybe we can do activities at a different time so that we're not doing showering in the morning. We can do it later when anxiety levels are lower. How are we managing anxiety? So we know that if a child is sensitive to tactile sensation, that their anxiety around those activities is going to be much higher. So can we support them to be well regulated in order to cope and manage better with that activity? And can we change anything about the activity? So is there something about school uniform that is uncomfortable for that young person? And can we have a conversation with the school about that? And how can we adapt that to make that more comfortable? So that's just, I guess, one example of one challenge in one sensory system that we could think about. But there might be multiple ways that we could make that activity much more comfortable for that young person.
Oh, thanks, Gemma. I think you've just sort of shown there that occupational therapy is just going to have such a broad but really impactful way of supporting children and young people with additional needs. So yeah, thank you very much for your time today. And we look forward to talking to you again soon. That's great. Thanks, Gemma.
So much.
Thanks.